ready? The sooner we start, the sooner. I think we're ready. Are we ready? Okay. Welcome, everyone. We will go ahead and call to order the Board of Health, Shawnee County meeting.
Good morning, Commissioners.
Good morning.
I am Ed Kalis. I'm the Division Manager for Environmental and Community Health, and on behalf of Allison Alejos, our Director, I will be doing the line list here and introducing folks.
Good.
The first person on the agenda is Linda Oakes, and she's going to talk about the relocation of the local health department.
Good morning, Commissioners. Okay, I'm going to give you a quick update on the relocation of the buildings. There's, of course, we've been working on two. The first one is the 2600 Southwest East Circle Drive. That's, I call it the McVicker building.
Mm-hmm.
There's still a lot of work going on with that building, a lot of meetings with the architect. I know Bill Kroll is still the project manager. We did have a bare bones tour for the staff on December 1st so they could kind of visualize what it's going to look like for them. And so that work just continues hard. The plan is to be moving in June, and we're still on track for that plan. The other building, the 2115 Southwest 10th, December 17th and 18th, the Communicable Disease Program at Central Park and the Immunization Program from the Maine moved into this building. We were closed for 2 days and then reopened on the 21st. And just a few pictures I took. It's a beautiful building. The staff is loving it. This is the check-in desk and the lobby. Lots of windows and sunlight. And then this is one of the nurses' stations, a couple of the nurses working there, and then one of the immunization rooms. And so we are full speed in that building and going very well. So I'd be happy to answer any questions about the moves at this point.
I don't have any. Thank you for the update, though.
Yes.
And I'll be doing the next couple slides.
Okay.
The Communicable Disease Department has kind of gone through some reorganization with the relocation over to 10th Street. The supervision of the nursing staff was mine as far as the Communicable Disease Department before. That has been moved over to Linda Oakes. So she's taking care of all of the clinical staff at 10th Street, which would include the CD department. I just kind of wanted to show you what we're doing in addition to the normal day-to-day work. We're kind of working on some quality improvement programs to be able to help us become better part of the community and do the work that we do better than we were before. One of the first things that I'll talk about is the monthly surveillance indicators, and it is a report that started to come out from KDHE in August, and the things that we do go into an electronic surveillance system called EpiTrax, and so everything that we put in there goes to KDHE, and some of it will go on to the Centers for Disease Control. These indicators allow us to know which of those fields that CDC is interested in that KDHE needs to report to them are making it to them. So we will get percentages of the field for death and with the date or the last name or whether the person was pregnant or not. So we're getting this report that allows us to do some quality improvement programs, allows us to show where we're doing a good job and what fields that we're not doing such a good job, and then to do some Plan, Do, Study, Act quality improvement projects to be able to fix that and to make it better. There are a lot of things on there that we've really never looked at before, so those are the ones that at some point we'll get to, but we're going to try to hit the low-hanging fruit first. Another thing that we really haven't done a whole lot of over the years is work with medical providers. As you probably know, medical providers are required by law to report reportable diseases, the ones that are in the state statute. We have never done any kind of survey to see what percentage of folks actually do that. We're guessing that not every doctor that suspects a reportable disease reports it to either KDHE or to us. So in the effort to make a connection, we're going to start sending out a monthly newsletter to those medical providers. We'll base it on a newsletter that Sedgwick County does, and they do it every week, but they're good at what they do, and they've been doing this for a long time. But we're going to start off monthly. That will kind of give the providers an idea of what's going on in our community at whatever point we're looking at. And we'll also provide them other information from CDC, other kinds of connections to where they can start thinking of communicable disease as a community issue and not just, I've got a patient with measles, I need to tell somebody, or I've got a test that I want to send in and then the health department will learn about it from test results back through KDHE. We want active reporting. We want the medical providers to actually say, oh, I need to call the health department and let them know that we have this patient who has a reportable disease and this is what I need to tell them. So hopefully with that newsletter we will start that process. And the last thing on this slide is the epidemiologist position. We've talked a number of times over the past couple of meetings about getting an epidemiologist and how important that could be to our programs and to the community. Basically, I have to say at this point is that looks like it's going to be a thing that Allison's going to be closer to talking to you guys about and maybe even bringing up and putting forward here in the near future. One of the issues at one point was funding the position, and we found some money through the reorganization of the Communicable Disease Department when one of the CD team leaders left. So Allison, I'm sure over time, will be talking to you about that position. Emerging issues. Now, I know you all have heard about bed bugs, and maybe you've had bed bugs. I don't know. I'm not going to ask because it's one of those things that people don't like to tell. I wanted to let you know, there are a lot of things going on with critters, parasites, and other kinds of little animals that people don't like. But the one in our community that's come up the most over the last year are complaints about bed bugs. I don't know that I've seen it anywhere a lot in the news or even in conversations with people that I've talked to, but at the health agency and even through some of the city connections that we have, we're getting more calls than we used to. We'll have homeowners call us and say, I just took a trip to wherever and I think I might have bed bugs. What do I need to do with the luggage that I have in my car right now? And how do I keep it from getting into my house? So we work with some folks on that. But that's not the biggest area where we're worried about things. I'll tell you the biggest place where we've seen the most complaints come in are residential group homes. We're getting a lot of, I don't know how the bed bugs originally get there, but homes where folks are being taken care of and they really don't have a lot of control over their activities. They seem to be getting more reports of bed bugs. And the problem is remediating bed bugs costs a lot of money. It's thousands of dollars to actually do treatments. So that has become an issue. And there have been offices and other businesses who have clients from these residential group homes that are worried about the bed bugs getting into their facilities. So we've done a couple of, gone to offices and told them what they can do. It's become a bigger worry. And because once you have them, you may not get a huge infestation, but there is that possibility. And a lot of people don't understand the life cycle of bed bugs. They're not quite sure what to do. They're all worried that they're going to have to spend thousands of dollars, which if they do it a certain way, that's probably the case. So we do send people information when they ask for it. We do not go out to houses, private industries, or anything like that at this point, but we just kind of want to let you know. Now, how big of an issue is this? I would say 4 or 5 calls a week, but that can be quite a lot depending on the level of infestation a place has. And the last thing that I'm going to talk about is our emergency preparedness program, the public health emergency preparedness. One of the things that our grant has required this year is that we help basically facilitate the process of creating some kind of a mass fatality plan, and that would be the plan that the county is going to use if we have a large number of dead people. What do we do when we have a bus crash, or when we have a building that collapses, or God forbid, a plane crash in our community? What happens? Now, it's part of our grant, but in an effort to work as a community and basically to let the coroner do what is really his purview, we are working with the coroner and the sheriff's office on creating that plan. Other community partners through our ESF 8, the hospitals and a lot of those other folks, the Vallejo and the mental health issues that would happen in those kinds of activities are also being involved in that. So we just want to let you know that that's what we're working on, and hopefully we'll have something done in the spring as a community-wide plan for mass fatalities. We're hoping nothing happens, but we have to plan like something's going to happen. Do you have any questions on those 3 slides? Okay. So the next presentation is Linda again, and she's going to talk about immunization updates.
Okay, I'm going to talk about a different kind of bug, not bed bugs, but honeybees. So this is Operation Honeybee. This is a program through the Kansas Department of Health and Environment to recognize health departments that give the highest percentage of adolescents the 3 recommended vaccinations, the Tdap, Menactra, and the HPV. And they're divided into peer groups, and so our peer group is the urban group. And there's one award each quarter. There's been, 1 quarter was the baseline, and then we had 2 quarters of awards. And guess who won in the urban group in both quarters? Us. We won. So we may not have won the lottery, but we did win this. So Why is this important? You might remember this slide I brought to you last time or the time before about HPV vaccination rates in the country. The Kansas rates for Tdap are 79.8%, so that's pretty good. It's not great for a required vaccine, but it's pretty good. Meningococcal, 65.1%. So Kansas is among the lowest states in rates in that vaccine. And then for HPV, our coverage rate is 38.3%, and so we have the dubious honor of being the lowest in the United States. So that is why this is such an important project. For our agency, we do track rates, and I'm happy to say our rates are quite a bit higher than that. For Tdap, we have a 97% rate. For meningococcal, we have 86%. And for one HPV vaccine, we have 73%. It's a 3-shot series. And so for 3 shots, we have 47%. So we have some work to do, but we're doing pretty well. We're still below the national average, however. So how have we won this award? What have we done differently? And I think the main thing is training our staff on how to talk to parents. That we present this as a shot that prevents cancer. I think it's very important to say to parents, if you could give your child a vaccination to prevent cancer, wouldn't you do that? And so that's how we have changed our message. We're talking about cancer. And we also come in and say, your child is due for 3 shots today, not your child is due for this required shot and these 2 recommended shots. We present them all as a package. So that has really helped. The other project we're doing is school-based clinics. We've started in 2 districts this year. We had 2 clinics in the fall. The turnout was low. We're doing 6th graders, so we're going to meet the school nurses from those 2 districts in our committee are meeting next week, and we're going to do some quality improvement exercises to try to get the word out and try to get more people to come in for the spring vaccination clinic. So parents of 6th graders have the chance to do all these vaccines at school. How convenient is that? So we're going to keep working on that and go ahead and probably do it again next year and see if we can't keep improving and adding more districts as we go. The other project we're doing this spring, the Immunized Kansas Coalition has a program called Adolescent Immunization Recognition Awards. They're giving an award of $5,000 to the health departments who have the most improvement in their rates for HPV. So we have signed up for that award, and we're going to be working again. The school project will be our project for this program. So I hope to be able to come back and say that we won the whole year for Operation Honeybee, and we won $5,000. So,
That'd be nice.
and I would be happy to answer any questions about that program.
Linda, which 2 school districts are you working with?
We did Seaman and 501 this year. And as I said, we hope to expand that.
Okay. Very good. Any questions? Commissioner Cook?
Linda, what is going on in Nebraska with the HPV? I mean, we have Nebraska identified as a very, very high rate of vaccination. It's really the highest of surrounding states for us. What are they doing differently than we are? What's going on?
You know, I don't really know about Nebraska. I know, I do know Rhode Island requires it for school. I do know that. And so they have a very high rate. I don't know, and I could certainly look into it, but I don't know if they require it also. Do you know that? Okay.
I was just looking at the slide, and on the slide you have Colorado is high, Missouri is just a little bit above us, Oklahoma's just a little bit above us, but Nebraska's heads and shoulders above, and I didn't know if you knew what the difference was.
I don't.
Okay.
And as I said, the only state I'm aware of that requires it is Rhode Island. They just started that a year ago. So.
I was like, instead of reinventing the wheel,
Sure.
Yeah.
look at what
I
other
will
people
look
are
into
doing.
that. That's a great idea.
One thing to keep in mind about Nebraska, Commissioner, is also that the structure of the public health system is very different. It's,
You know what, Dr.
Sure.
Buzina, I might have you come up, just because they won't be able to capture your
you're right. I
voice.
forgot about that. I was saying the structure of the public health system in Nebraska is quite different. Nebraska is a state that up until, I think about 15 years ago, didn't even have local health departments. And essentially all services were provided by the state. Then about 15 years ago, they established, I believe, 6 or 7 health departments, and they covered primarily the urban areas, but there is still vast areas of the state where the state health agency provides all the services. So all that to say that there are things that may not be comparable to us. I'm not here to advocate one system versus the other. It's just they're just different. Kansas has a very decentralized system with 105 counties and as many local health departments. And sometimes it's a little difficult to coordinate all the activities among all the many players as opposed to a state like Nebraska where things are more concentrated and centralized. So it's a very interesting question. I don't know the answer, but I'm guessing that part of the answer at least might be in the difference in the structure of that system.
Thank you.
Thanks. Anything else? Any other questions? All right, thank you, Linda.
Our next presenter is Craig Barnes to talk about East Topeka Farmers Market and the SNAP Double Up.
Thank you. Morning, Commissioners.
Morning.
So, like Ed said, what I'm going to talk about today is talk about the East Topeka Farmers Market and then some exciting new things that are going to be coming here for the new market season here in 2016. So to start off, a little bit of background information. The East Topeka Farmers Market was something that we started last year. It was something that was identified within our Community Health Improvement Plan as something that we needed to do for East Topeka, was increase the access and availability of healthy foods to low-income families. So we started the East Topeka Farmers Market in an area at what the old Avondale East School and Net Reach Center through a Kansas Health Foundation grant last year. We picked that location primarily to start off with because it was in a known food desert there on the east side of Topeka and in an area where we thought residents would get the most use out of it. So we started it off in April of 2015. It was the first and third Tuesdays of each month. So we did it twice a month, and we ran it for 2 hours. What we did, and I pulled up this map here, this is the food deserts here in Shawnee County, and as you see that yellow star there, that was where we picked as the location. Now we picked that location because it was separate from the other 6 already established farmers markets here in Shawnee County. It was a little bit more south and, like we said, in the food desert, so we thought it would be a perfect fit for that area.
Okay, could you just explain food desert
So,
just a little bit?
Yeah, so with the food desert, that is an area where they don't have the direct access to healthy options for food, for healthy food, and typically it is determined by their social determinants of health, and so a lot of times low income as well. So we ended up having to move the location for our farmers market, and so we ended up moving it to this yellow star here in June. And so it then became the East Topeka Farmers Market, but we were housed at the Topeka Housing Authority. And so at this time, I kind of want to introduce 2 of our guests, if I can. We have Sophie George and Audrey Kofel, both from the Topeka Housing Authority, very integral in helping us find a new location, still in a food desert, still making sure that we were working with that low-income demographic to make sure that we were still getting the people the access that they needed. So when we moved locations, the best thing about it was April through June, we were averaging about 16 consumers showing up at the market on a regular basis. When we moved from July to September, we started averaging about 40 consumers. Now, the nice thing I want to point about the 40 consumers is we had, 4 different times where it was thunderstorming, pouring down rain at these markets, and we still had at least 40 consumers at those markets. At one time, we even had 61 people show up to the market. Now, the nice thing about the changing the location, if you're familiar with the Topeka Housing Authority right there off California, is the accessibility and visibility. When we were at the Avondale East Net Reach Center, we were in a neighborhood kind of secluded back off of Adams and 29th, and then we were also behind the actual school on the blacktop. So it wasn't very visible. So even for our farmers who were setting up, people in the regular community who were coming by, if they didn't see our little signs that were out, they wouldn't even know that there was a market going on. When we moved location, visibility was key because we had that parking lot right there in front. The signage was out all to the time, so people knew that it was going to be there on the first and third Tuesdays. And then all of our farmers, as you can see here, the Finks, they set up, they had the umbrella, so it was easy. You could see at least something was going on, so at least might pique your intuition, like, oh, let's go check out what's going on here. So that was a key. And then accessibility. Like we said, that area right there, we had a lot of low-income people who were, had access to then could come to the farmers market. So one of the exciting things that came out of this was getting a lot of feedback from the actual consumers. And so we had a lot of people who were coming to the market who were trying to spend SNAP dollars, and then there's senior farmers market nutrition vouchers. And I'll talk about both of those here in a second, actually right now. So for the 2016 market season, literally a second. So what we're going to be changing and doing differently is we're going to look at a couple of things. We're going to look at increasing the market availability so that we do it every Tuesday from about mid-May to October, so changing the time frame, but also increasing the time available for the farmers to be there. That was one thing. The 2 hours didn't really work so well for the farmers because they had to set up, get all their produce out there. So it wasn't really feasible and really cost effective for them to come out there and just set up for 2 hours. So they asked that we increase the time frame. So it was worth for them to get a whole bunch of produce, come out there, and our farmers were repeatedly selling out of produce at the market. So if they're repeatedly selling out of produce in that 2 hours, now if they can have a little bit more time to prep, come out there with a little bit more produce, and spend a little bit more time out there, they're hoping that that will be really good for them. We're going to also look at doubling the current number of farmers. We had a couple of farmers who have already contacted us who are interested in participating coming out this new year. There's been some public knowledge now of some of the things that are coming out that I'll share with you here. So some of the farmers are really excited to get on the ground level for some of that support. And then the other thing is to offer farmers who accept the Senior Farmers Market Nutrition Program vouchers. What those are is vouchers that come through KDHE and through the Department of Health Promotion. They're $5 vouchers that they can get, and they can come spend those vouchers just like regular cash to any of the farmers who accept those vouchers from the Senior Farmers Market Nutrition Program. So that farmers have to go through a protocol of training to be able to accept those, and then they'll have a little sign that KDHE supplies that they put in front of their booths to know that they accept those vouchers. We had repeatedly seniors coming to our market last year who were trying to spend those vouchers to ask if we accepted those. We didn't last year, so that's one of the things that we wanted to make sure that we added this year. The other thing I talked about is the SNAP dollars. So SNAP is kind of like the vision cards, EBT, food stamps, basically, for those low-income families. But one of the things that we're really excited to announce this year is that we will be offering a double-up program through the Market Match out of Douglas County. We were able to partner with them to offer that service. What I want to do here is kind of break up the monotony of me talking here, and our partners there at Douglas County put together this wonderful video that will spell out exactly what the Market Match program is. And it didn't work. Okay, so let me tell you what the Market Match program is. All right, so the Market Match program was started in Douglas County. And they started it at their large farmers market that they do on Saturdays, and then they branched it out to another market. But what it is basically they have funding to match anybody who comes in to spend their SNAP dollars. So what they're offering to us is a part-time coordinator who would offer technical assistance to support us, the equipment, the dollar-for-dollar match, promotional materials, social media platforms, and anything like that. But people who have SNAP cards, those vision cards, can come to the market. They'll go to a centralized location. They'll slide their card, and then it'll match up to $25. So they can slide their card to get some tokens. We'll use tokens for $25, and then on top of that $25, we'll match it. So then they have $50 to spend on locally grown, healthy foods here from the community. So that money will then stay in the community, and then just make it really easy for them to spend more money on healthier items. Make it a lot easier than going to Walmart and buying, something that's not locally grown and you know exactly where it came from. Nice things about this is you can talk exactly to the farmer who grew it, know exactly how it was that they grew it, and a lot of the times they have, if you've been to a farmer's market before, there's stuff that I don't even know what it is. And it's nice to be able to talk to the farmer and be able to say, well, here's a way you can cook this or prepare this as well. And so it's a nice way for you get an educational component to it as well as making sure that your family is eating healthier. So we're really, really excited about that. So, since that didn't work, we'll have to do this. So, what's the Love program? Well, as I mentioned, we partnered with an agency that's already started this Market Match program. And so last year, there were 6 markets that were running that same Market Match program. So if you see there, the SNAP total, that was how much money they took in SNAP dollars in those 6 markets, so $17,000. Then they matched almost $17,000 worth of those same SNAP totals. So with that out of 323 total SNAP users that attended those markets, those markets, all 6 of them, brought in $34,000. So $34,000 amongst low-income individuals were spent on healthy foods for their families through those 6 markets, which is pretty cool. So that's something that we'd like to be able to see happen here in Topeka, Shawnee County. So, and to put that in perspective, in Shawnee County, from the most recent data that I could find, we have 26,000 registered people who accept SNAP benefits here in the community. So if we can just touch on even a small percentage of those people and make it available for them to get fresh, locally grown food, we would be extremely ecstatic. So, and then with that, I'd be willing to answer any questions that you guys have. As you can tell, I'm kind of excited.
Yeah.
So.
That's a good thing. That's a good thing. Questions?
No, great.
Yeah.
Awesome. Perfect.
What's in it for Douglas County? I mean, what?
Just really just promotion for them, just to get it out. I mean, really, they're there to help make sure that we're offering a better chance for all residents here of Kansas. So they're not really getting a whole lot in return from it, other than the Topeka Community Foundation was one of their where they got a lot of the grant dollars for. So in turn, it's kind of be nice to bring some of that money back here into the Topeka Shawnee County.
They're spending their money and their time and their expertise to help us.
Yeah, they're getting some supplemental funding from other organizations to offer those trainings, but it's kind of one of those train the trainer things. If they could help us do it, then we can in turn help other communities as well with our knowledge base on how it worked out as well. And so hopefully in turn then we can get a lot more Kansas communities offering the same type of services, and so low-income individuals will have that direct access to healthy food options.
Thank you.
Craig, what's the furthest point that you have farmers come in? I mean,
The
I know they're not just in Shawnee County, but are they?
Right. The current that we have right now are all local Shawnee County farmers. We have had some interest from some farmers in Manhattan that might want to take part in the next one, as well as Silver Lake for this next coming year. So that would be then the farthest that we would have for this market. But I do know for markets in general in Shawnee County, I mean, they come from all over the place. Douglas County, Jackson, Jefferson, Osage, we see them come from all over the place.
So if they're interested, contact you?
Yes.
Okay.
Yep.
All right.
Perfect.
Okay, thank you.
Thank you.
Tara Demick is here to provide an update from Heartland Healthy Neighborhoods.
Good morning.
Good morning.
All right, so I got to try to work this. I saw them touching buttons. Okay, so all of you have now received, because Commissioner Archer, I just handed you your folder.
I just had it, and I meant to
Well,
bring it
I
up.
just wanna make
and
sure
I
everyone
did-
had
yeah,
it,
it's on my
and
desk.
I believe Allison got you yours,
Yes.
Commissioner Cook. So what we decided was, rather than a brochure to tell you what HHN is, you really, one of the biggest issues that a coalition has is new people getting up to speed. And so this is the up to speed. It provides you all the information about all the work groups we have, and it also provides you where we're at with the Community Health Improvement Plan, because those are being updated constantly. And so we updated and have a folder for that to go into as well. So just to recap, Heartland Healthy Neighborhoods, its mission is to mobilize the community to take action, focused on health priorities, so that policy environment practices are influencing a culture shift that's focused on health and wellness. So that's what HHN is. In December, we held a meeting. We had a little over 80 people there, and we shared some of the celebrations. This is only some of the things that have happened over the last year, and I'm going to attempt to tell everything that the co-chairs shared, so I may be a little bit off, but I'll do my best. There's currently 6 work groups that work underneath Heartland Healthy Neighborhoods. Healthy Babies, Healthy Eating, Active Living, also called HEAL, so if I say HEAL, that's what I mean. And then Access and Knowledge to Healthcare. Those 3 are the ones that are within the Community Health Improvement Plan work. There's also the Complete Streets Work Group, which has a corner of the Community Health Improvement Plan and is working with the Kansas Health Foundation. And then there's the Work Well Shawnee County and Communities of Care. I'll share a little bit more about those as we go. So the first work group that kind of shared some of their celebrations is Healthy Babies, and this is the community baby shower. So they came together and they created the community baby shower as a group. No one had an agenda. It was very pure. And within that, they gave every single new expecting mom a baby bed. It's a pack-and-play baby bed. They also got diapers as well as a wealth of information and some resources. And this just shows you kind of a look at how many people are engaged in volunteers that are helping. There's a large portion of this that is actually the leadership in it and that are attending those Healthy Babies work group meetings every single month. They're also working on the O Baby Guide. The O Baby Guide's in front of you, and it's online as well, and it's a resource guide for the expecting mothers so they know where to get all the information they have. Coming together as a group like that, they're really able to identify the resources that are needed and what's missing in a directory. So the next group that I'm going to talk about is the access of knowledge access and knowledge of healthcare. This work group has been working on two main priorities, a transportation directory as well as a health directory. The transportation directory, they have checked off their list, although it will always be a work in progress as they try to promote this. What they found was the best directory was actually housed by the Topeka Metro on their website, topekametro.org. And so this kind of gives you a guide for how to find it. It's over in the other transportation options. And then there you find the medical transportation services. And within your book, you actually will see the Excel spreadsheet that has been compiled and then reviewed by the Topeka Public Library, different providers, Shawnee County Health Agency, to ensure that it is up to date and provides all the services. So this gives anyone who needs to be able to give answers a very great resource of those answers. Now, as they continue on in 2016, they're working on the health directory, and they're working with all the partners within Shawnee County that maybe already have a directory, trying to find the best resource and also collaborate and come together on something. So that's what they will be doing over 2016. All right, the next group, you've seen this. Craig Barnes was the lead on this with the Safe Routes to School and did a great job of starting something. And that's the best part about this, is that because of all the work that went into the Safe Routes to School project, we have had at least 2 grants that are going through the city that received just a vast amount of support because of this work. Because people started seeing the need, they started understanding the support that was needed by the community to make a grant work, and why maybe we didn't receive a grant in the past, and how we can work together better as a community. So that the great part is the work that was done, but the best part is the work that's now continuing, and that we're going to see some really great results from. The second part that we're talking about, but as Craig talked about the SNAP and some of those, the partners that have been built is just phenomenal. The farmers market directory was something they did. Craig, they did it in a weekend? Did it in a weekend. So they found a gap that we were missing farmers markets, a directory. They needed it right away, and so the group came together and made it happen over a weekend. It was fabulous. That's in your book as well, so if you ever want to see it, it's also on the HHN website. So Complete Streets. So this one's fun, because I always like giving away money. I really had no idea how much I like giving away money. Maybe my husband doesn't appreciate that. So the Complete Streets, the way this worked is Complete Streets has received grant funding from the Kansas Health Foundation. And this year, it was very exciting. Rather than making another program, another project, another something, they came to us and said, you know, you have your grant dollars. If you see something that's viable and that could use the support that you have, the dollars you have, and you could give that into your community that's going to move Complete Streets policy forward, then that's what we want you to do. We want you to give the money to the work that's going on already. So we worked with our work group. Our work group went outside of its work group and asked the Topeka Community Cycle Project, as well as the City of Topeka, Shawnee County, what is the best use of our dollars? So the first project I'm going to talk about, we had $30,000 that we allocated to give. The first project is this bike education program. It was created by the Topeka Community Cycle Project. They had already gone to the Topeka Community Foundation. The Topeka Community Foundation said, yeah, we're in for $10,000 if you can find the rest of the money. So they needed $23,500. They had already gotten over $50,000 in-kind support from the USD 501 saying, yes, if you can make this happen, then we will provide your education in our 501 school district. Children will be educated on bikes programs within physical education. The programming is going to be done by certified bicycle education specialists who have provided in-kind support as well. So we were just the ones who got to be the great final gift to say this is going to move forward, and we gave $13,500 to the Topeka Community Cycle Project. So we still had $16,500 left, and the next biggest and most critical thing that we saw as a need is the Topeka Bikeways project. It's continuing to move forward, and the plan needed to have the signage paid from non-governmental entities. So we were able to come in, we completed phase 1 with that 16.5, so phase 1 of the Bikeways plan signage portion will be complete, and we will start into phase 2 with those dollars because they're significant enough to make that kind of impact, because the money, they've been able to find a way to get it at a lower cost. So that's another exciting element that we get to do. Moving forward, the PED plan has been complete, and the committee is working right now with the city to figure out how our involvement with the Complete Streets Advisory Committee could be a possibility, and what our role is going to be moving forward with promoting active living. All right, so those 4 are the ones that meet every second Monday of the month, and they're regular every month. These groups meet every month as well, but they're on different days. The Work Well Shawnee County group has had some really great things happen this year. One is the Bike for Discounts, which I think we've told you about a little bit, but basically you bring in a helmet because you rode your bike that day, and that business would give you a discount. So they're working to grow that program. The Live, Work, Cook Well is a cookbook that they developed with all their organizations that work with them. And then they work together on the National Walk at Lunch Day. Now, this is just a few things they work on. You know, really the group is about is trying to develop policies and work together to help promote work well policies that help improve the health of their employees. Okay, so there's one more group before I get to the very end. The newest group is the Communities of Care group, and you'll see it in your book, just kind of a small description. It literally just started, I think less than 6 months ago, maybe 4 months ago. They came together for their first meeting. This is a partnership between us and the Kansas Foundation of Medical Care, and it's focused on those citizens who are utilizing Medicare and how to make and support that particular population. And so we're excited to see what will grow from that group. And then the final thing, and you might have heard it on the news, but we did receive a $50,000 in-kind gift from the Kansas Leadership Center. And so we'll be utilizing that to educate all of our members and our partners friends to help encourage leadership and leadership within Kansas. So we're really excited about what that means for Heartland Healthy Neighborhoods. And the final thing, before if you have any questions, is this quote. We've had this quote since, 2014 or 13, maybe 13 is when we found it. And it's the Henry Ford quote, but it's been very significant to us as, you know, coming together is the beginning, and then keeping together is progress. And, you know, you don't realize how important that keeping together is. And then working together is success, and we really feel like we're moving in a really great direction. So thank you for your support. The Shawnee County Health Agency has been invaluable to us. They're phenomenal, and it's incredible what we have in Shawnee County. So do you guys have any questions about anything?
Questions? I just might like to add a few things, because I think when I attended the December meeting, it was really evident that there were lots of new people who stepped into leadership roles, and you didn't see just the usual people up there giving presentations. There were a lot of new people, and that's encouraging.
Yeah.
And energizing, I think. And then I think, you know, oftentimes when we sit at economic development meetings, JADO, Go Topeka, we hear about this quality of life aspect of our community. And, you know, HHN is a coalition within Heartland Visioning, and you all are really the grassroots, you know, quality of life people helping improve the health of our community, but making exercise an easy choice, healthy eating an easy choice. So I just, you know, want to make that connection. And I think that oftentimes, and maybe this is something we could do for our next Board of Health meeting that we have every quarter, is folding into the conversation more of the business aspect of it, that we need to have the chamber, maybe some Go Topeka board members that are involved in that. I know recently, I think the commissioners may have been sent this as well. It was some information from the realtors on, healthy living, building a healthy community, all that sort of thing. And I emailed Linda Bryden and said, just wanted to make you aware of this group who's doing some really great work. And she says, wow, thank you. Did not know that. I will make sure I attend. So I think it's kind of our job to connect those dots. And so thank you and for your leadership as well with Heartland Healthy Neighborhood. And I know everything is connected here with health. So thank you, Tara.
Thank you, guys.
Next.
Diane Creek is next to talk about NurseFamily Partnership.
Good morning, Commissioners. I'm just on the downhill side of a cold, so hopefully my voice holds up. So, we instituted NurseFamily Partnership in 2013, and it's a program that's an evidence-based program. It's a community health program for new moms, brand new moms, and it transforms lives of vulnerable first-time mothers living in poverty. So to qualify, you have to be a first-time mom, you have to be in poverty, and basically at high risk. And our goals are to improve prenatal care, the quality of parenting, and the life prospects for the mothers and their babies. And the visits are done by a registered nurse. The NurseFamily Partnership model is 37 years old, and they've done a lot of research on it, so it's evidence-based, which makes it even that much better. They've shown that it works in several studies. They even continue doing research now, so it's an ongoing process. These are the states in the United States that have NurseFamily Partnership. There's very few that don't. And then in each state, the number is how many programs they have in that state. So like Oklahoma, the whole state has NurseFamily Partnership. The whole NurseFamily Partnership program is all around the world also. There's some in Australia, there's some in Netherlands or Switzerland, Europe. So there's a lot of programs out there. And the program goals are to improve pregnancy outcomes, improve child health and development, and improve parents' economic self-sufficiency. Sounds pretty easy. The key components are first-time at-risk moms. They're seen by registered nurses. The services are very intensive. It focuses on behavior. So the nurses go in the home and try to work with the mom on how to improve behaviors, improve choices, those kind of things to try to get moms to help improve their lives and their lives for their babies. And the program, we have to follow strict guidelines with the program for fidelity. So there's a lot of paperwork with it, a lot of paperwork. The outcomes, this is national outcomes, 79% reduction in preterm delivery for moms who smoke. Smoking is one of the things that we try to get moms to quit smoking, and that's tough to do. I don't know what happened to my percentage on this one. Reductions in high-risk pregnancies for as a result of greater intervals between first and subsequent births. They like to have 2 years in between babies. And that gives moms time to be a mom to the baby and to get healthy in between births. 59% reduction in child arrests at age 15. This is part of that research that they've done over 37 years. They found that the kids that are born from NFP moms are less likely to be arrested. So hopefully, we can reduce the number of people in jail. Child welfare, 39% fewer injuries among children because they talk about a lot of health issues, a lot of safety issues. 56% reduction in emergency room visits for accidents and poisonings because that's part of the educational component. and 48% reduction in child abuse and neglect. 50% of the children are they don't have language delays at 21 months, so they're more ready to go to school. There's a 67% reduction in behavior and intellectual problems at age 6. So school should be easier for them, and they should do better. 68% increase in father's presence in the household. That seems to be a problem with most of our moms. A lot of them are single, so they have very little support. 61% fewer arrests of the mother. One of our goals is to help the mom work, either get education and get a job, to get herself out of poverty so she doesn't have to reduce to a life of crime. 72% fewer convictions of the mother. And our goal is to have increased economic self-sufficiency so that they can, by the time that baby turns 2 years old and they graduate from the program, they can be out on their own and be successful. And so they want fewer unintended subsequent pregnancies, so we talk about birth control, planned pregnancies, so the program as a general has 32% fewer subsequent pregnancies. At the increase in maternal employment, 82% increase in months employed, and reduction in welfare use, 20% reduction in months on welfare, which ends up saving the state and the county money. And I will introduce Bonnie Gonzalez. She's the team leader for NFP, and so she will finish out with our on-county staff.
Thank you, Bonnie. Good morning, Commissioners.
Good morning.
I supervise a group of 4 nurses who carry out this program, and to date, those nurses have served a total of 105 women, being enrolled in the program since its beginning. They provide, as Diane said, an intensive service, multiple visits to the clients, and the hope is to keep sort of the same group of women on the program until their babies turn 2 years old. And so almost 69 infants have been born to, not almost, exactly 69. Have been born to NFP moms to date. And when we look at who our clients are, they range in age from 15 to 40 years. I did a lot of math and found that the average age in enrollment is 21 and the median age is 19. And so I guess that tells us, as I looked at it, that approximately 50% of the women who come into our program are teenagers between 15 and 19 years of age. And so it's, super important to us to be able to take these young women and help them to develop the skills that they need to move forward with their own life so that they'll have a better life course, and also to provide an environment and a relationship with their child that will lead them to becoming a more productive and higher functioning kind of person. And we've seen some examples of that in our program. Looking further at the demographics, 86% of these women who came into our program were unmarried at program entry. Very few of them had supportive families I guess they all had families, but some of those families are really not very high functioning themselves. And so the level of support was not necessarily a very healthy support. Probably, and this is just anecdotal, I don't have any data on this, but probably only about half of these women had the father of the baby involved in their lives in any significant way. The median level of education for these women was 11.5 years. And one of the things, we're kind of moving in, that was demographics, and now we're looking at some outcomes. The outcomes that Diane shared with you were really what the national program found in longitudinal studies by following these women who were served during the first 2 years of their women's life, and then looking forward to see what impact it's had on the mother's life and on the child's life. And so we can't really do that since we're finished with them, excuse me, at 2 years of age. And so all we can do is to look for some markers, excuse me, that would show that we are really making a difference. One of the most easy thing to show, because there's some comparative information, and that's on immunization rates for children being up to date at 2 years of age. For the state, it is 61.5% of the children are up to date at 24 months, and in Shawnee County, only 45.6% of 2-year-olds were up to date in the most recent data release. In our program, 100% of our children have been up to date on their immunizations at 24 months of age, and so we're very proud of that. 89.5% of the women that enter our program, who deliver babies after entering our program, breastfeed when they have their baby. And 40% are continuing to breastfeed at 6 months of age. And I'm thinking it was still about 20% at a year of age, and we're getting ready to graduate one this month who is still breastfeeding at 24 months. And the importance of that is that these children have a much better course in life with their health as well as cognitively, and it's been shown that breastfed infants do much better in school, and which can lead to other good things for that child. So we're very proud of that as well. 87% of our infants and toddlers have met Children's Cabinet objectives for language and developmental progress. And we do track development, provide a lot of guidance with the moms on what kinds of activities they can be doing with their babies to help them develop to their very best potential. This really says it all. NurseFamily Partnership helps families in the communities that they live in become stronger while saving money for state, local, and federal governments. And so we're putting a big investment really into these young women, but these are the ones who need the greatest level of support to prevent them from doing things like entering the jail system and those kinds of things, not being financial contributors to our economy. We hope to turn that around. And certainly one of the things that I want to do is just to share with you as I wrap mine up a success story, and I'll keep it very brief. This is a young woman who's getting ready to graduate from our program this month. When she entered the program, she was 17 years old. She was using marijuana and alcohol regularly. The father of the baby had been in trouble with the law. She lived in a very chaotic household. The mother was not employed and was they were all living kind of hand to mouth. The girl was not attending to school regularly when she found herself pregnant. And so when she came to us, she really had no direction in her life. She had no intention of going back to school, and she repeated that all the time to the nurse that she was working with. And she really was just kind of hanging on to this young man who fathered the baby as he continued to go further and further into a bad situation. And so when our nurse got with her, one of the things that she decided that she was really going to focus on, which seemed to be this mother's greatest need, is to developing a future vision, a vision of what her future might be and what her babies might be, and establishing some goals, both some long-term goals and some short-term goals, to getting out of the situation that she's in and moving more toward what she saw as her vision. And so, we enter this year, after 2.5 years of work with her. She is out of the chaotic household with her mother. She has her own apartment that she was able to afford because she's working full-time. And she, in fact, has just recently moved into a new apartment closer to the university because she will be starting Washburn, not this semester, but in the fall. And she has just so completely turned her life around. Her baby's doing beautifully, developing well, is in a child care situation when she's at work, which is a very high quality situation, and we couldn't be prouder than to have such an example that we can share with people. And thanks to you for supporting us, we're able to do this.
Well, thanks for your commitment. Thank you. Yes, Commissioner Archer?
Thank you, ma'am.
Bonnie.
A quick question.
Do you have any questions?
Yeah, I did. How are participants selected to go into the program?
As long as they meet the criteria for the program, which is being pregnant with their first baby and in poverty, they are eligible. And so we don't really select. People are referred into us. For example, they may go in for WIC certification, and so the WIC department may refer them to us, or they may go into their obstetrician's office or our M&I program, and that staff would refer them to us. So every referral that we get, we reach out and try to connect with that mom. And so sometimes the difficult part is getting them to answer the telephone and then to say yes, because it maybe sounds kind of scary. Who is this person who wants to come into my home for the next 2.5 years?
So we don't look at criteria like this is the person in the most dire circumstances versus this is the person that has the greatest chance of success in the program. We don't do that.
We don't. And, certainly when we look at, more of the demographics, we sort of touched on the educational level. The educational level of our clients range. The lowest is a 9th grader. We've had several 9th graders. The highest is women who had a master's degree, but for some reason they couldn't pull their lives together. And so it's from here to there, and what we do is try to discover what the thing is that they need the most help with and what they would like the most help with, and then try to solve their issues and move them toward a better life for themselves and their babies.
Thank you. Thank you, Madam Chair.
Any other?
Thank you.
Okay, thank you.
Now I'd like to introduce Dr. Buzina, our health officer, to kind of bring everything together that we
Very
talked
good.
about this morning.
Good morning again. So this is a lot of information. Your heads must be spinning at this point. So what I want to do, and I promise I will take just a couple of minutes and then we can wrap it up, but it's really help you reflect about some common themes that I've seen in all these issues, across all these issues, and also see how they all tie together. And hopefully by the end of the next 2 or 3 minutes, you'll be able to see that this is not happening by chance. It's happening by intent. So the first reflection for me, when I thought about all the things that were going to be presented today, is about the breadth and depth of the issues that our health department staff deal with day in and day out. When I was in training a few decades ago, the idea that part of my work would deal with bicycles or farmers markets would have been totally unthinkable. And now it's just part of our daily work, and that's the way it should be. So a lot of changes have taken place in the last few decades as a result of the change in the health profile of our communities and our understanding of what are the drivers for assuring a healthy community. But what that means is that we require a huge diversity of skills and a variety of much more than in the past. So again, you wouldn't find anybody in the health department who would be able to work with someone in the city on a bike program, and now you do have staff who have those skills. And so as leaders, we need to think ahead all the time and see what are the skills that are going to be necessary in the next 10 or 20 years for our staff to master in order to achieve the health goals of our communities. The second point is somewhat linked to the first one, which is because of the variety of programs, our work does not stop at the health department door. Now that's been true for a long time. Public health has never been the kind of a 9-to-5 job at the desk. You've seen some nice pictures about the new offices, the new space, but let's make no mistake here. A lot of the work, probably the majority of the work, does not happen in that space. It happens outside of that space. It happens with the work with our partners. How many partners from the community do you see every time we have these Board of Health meetings? I don't think we have had a single meeting without at least one or a couple of partners coming from the community, from outside of the agency. So this role of the public health is a connector in the community to bring different players together that can work together to assure better health in our community is becoming more and more important. A lot of outreach activities inside people's homes, inside people's businesses, whether we're talking about bed bugs or outcomes for babies. It just doesn't happen within the walls of the health department alone. And so the role of linkage also with community leaders becomes more and more important. So having people who have those skills among our staff is important. Not everybody is a born leader, and not everybody is a born coordinator that can bring together leaders from the community. And now the final point is the risk of fragmentation. So again, since we have all this diversity in programs, activities, outreach, activities, and so on, there is a risk that we're just going to follow just about anything that comes on our desk just because it sounds like a good idea. And that's not really a good, efficient way to operate. So we must have priorities, and we must have strategies that we can use to decide if an idea actually is something that should be pursued or not. And one way we do that is by following a vision for public health that has been developed in the last few years and that we have discussed already in these meetings. And this, hopefully, this chart is not going to look totally new to you. This is a chart that describes what we call the foundational capabilities and services for public health. And what you see here is what experts in the field and practitioners have identified as key elements that must be present everywhere, in every community in our country, to assure good community health. And so you have some capabilities that people and staff need to have, and agencies need to have. Things like assessment, surveillance, epidemiology, all hazard preparedness response, and so on. And those capabilities are applied to foundational areas in public health services. Now, if you look at this slide, if you think about what we have heard in the last hour and 10 minutes, I don't think I find anything that wouldn't fit in this scheme. You have heard about communicable disease control. Well, that's obviously one of the key elements, assessment, surveillance, and epidemiology. Community disease control is one of the foundational areas. And you've also heard about lifestyle elements, nutrition, physical activities. That's definitely part of environmental public health. It's part of community partnership development. And then there is this line that says there may be additional activities that are considered important by our communities. May not necessarily fit into any of these boxes, but they're important for our communities. So the health department has some responsibility to ensure that those activities take place. That's the role of our community health improvement plan. That's when we get with our community partners and we decide together what are our priorities collectively that we want to pursue. And for Shawnee County, those are right now around maternal and child health, healthy babies, and healthy lifestyles and nutrition. Everything you've heard fit in this picture. So the reason I'm showing this to you again is because we make an intentional effort to find strategies, and what you see at the end is the result that's fragmented in different activities and outreach initiatives and programs, but there is a common thread there. The common thread can really be reconciled through a model like this. There is a lot of intentionality in what you see, and I want to be sure that that doesn't get lost. That's really all I have. I hope this has been helpful and interesting for you. I know it's a lot of information. If you have any other questions now or later on, just let us know.
Commissioner Archer?
Yeah, if I may, and I know we're running a little late, but I did have a question, and it regards hepatitis C and the new treatment options, and what impact that may have on our health agency. I know it's very controversial at the state level. I've seen a lot of heated discussion on it, and I've talked to my son about it, and he indicates that the treatments are extremely expensive and that the treatment regimen is very strict, that you can't miss any of the treatments and expect to be successful. Can you, and again, I apologize for taking, since we've gone on, could you take just a few minutes? And
yeah, what I know, first of all, the direct impact on the public health side of our agency is probably not going to be very big. There may be, and hopefully you will start seeing these numbers starting from the next couple of meetings, but there may be a little bit more of an increase in the number of tests that are done to diagnose people. And so every time there is a positive test, then our public health staff has to follow up with the individual that's affected and collect a series of information. That's a reportable condition in Kansas, so we have the duty to collect information and send it to KDHE. However, as you probably are aware, we do not provide treatment in the public health department. Things may be different when you're talking about a community health center, because that's a primary care facility, and so I can't really speak for that, and I don't know if you really have an interest. Maybe we can schedule in a future session someone from the community health center that can come to you and tell you to what extent that has impacted their own operations. The final thing I would say, nationwide, it's an issue that's been debated and will be debated. The cost is very, very high. Right now, there are very few limits to the amount that Medicaid, Medicare, and private insurance will pay. If there is an indication for the treatment can be administered, but I don't know how sustainable the model is, honestly. And so I think that the debate will continue, and I can't anticipate what the outcome is going to be, but there will certainly be more discussion.
Thank you, Doctor, and thank you, Madam Chair.
Sure. Just might point out for our next meeting, I anticipate that we'll have some discussion on the most recent community health assessment.
The county health rankings?
And the county health rankings, yes.
That's our intention. The new county health rankings is scheduled to be released, I believe, around the 18th of March, if I'm not mistaken. So I think the intention would be to schedule another Board of Health meeting, maybe the third or fourth week in March, to review the latest result. And again, it's an opportunity to talk about these issues. I don't anticipate huge changes, but it's nice once a year to revisit this issue and see what else we can do.
Yeah. Okay, great, thank you. Are there any public comments?
Dusty Nichols, Emergency Management. I just wanted to say thank you to the health agency over the past year. They've had a couple of unexpected things pushed down that happened nationwide, communicable diseases, Ebola, those kinds of things that have popped up. Their professionalism, Dr. Buzina and Allison, and the way they very well clarified the situation to help the first responders from AMR, from the hospitals, from all levels, was tremendous. And their flexibility in using the incident command system, which we required, was a nice partnership, and it's developed really well. And just the fact that they're there, a lot of times we think of security and preparedness as the law enforcement man standing there or woman standing there with their hand on their hip at a roadblock. Well, we have people who monitor these situations, and we never think about that as being part of security and preparedness. It's hard to measure, but it's getting done, and I just want to say thank you from Emergency Management guys. So.
Good job. Thank you.
I would like to point out that public health preparedness is one of the items there we can do.
All right. Again, thank you all for being here. We look forward to seeing you in March.